Researchers say they were a bit surprised by the findings, essentially showing that a COVID-19 infection during the first wave of Omicron did not result in strengthened immunity against the second. The study looked at older adults in long-term care and retirement communities. The first wave of Omicron hit in December of 2021 and lasted until March 2022, with the second wave arriving a few months later during the summer. Everyone in the study was over 70 years of age, and even taking into account medications and health conditions, the reinfection rate during wave 2 was linked to having had COVID previously.
Having had one of these infections in the early wave didn't protect, in fact, make people more susceptible to getting an infection in the second Omicron wave. This is concerning because our entire vaccination strategy, especially for older adults, is predicated on the assumption that if you get an infection, you should have a period where you're protected from another infection.
Researchers say people who fell into this category were 20 times more likely to be infected. Experts say the findings suggest that this virus does not play by the rules the same way as others.
We've tried so hard to shoehorn SARS-CoV-2 into behaving like other viruses we're more familiar with, viruses like influenza or RSV. And SARS-CoV-2 just doesn't seem to always play by those rules. As an example, we haven't seen that movement towards seasonality that we would have predicted. And we also haven't seen that there's long-lasting protection from having one infection that leads to another one.
One thing researchers want to make clear is that they are not sure how their findings would apply to people in other age brackets. Experts say regardless of how old you are, being up to date with vaccines is the most reliable line of defense. Katherine Ward, Global News, Toronto.